Good evening, friends. My name is Nikita Bode, and today we are going to discuss about the marketing of drug. Marketing companies often promote product during the events or sale visit the doctors. This type of marketing is known as a leading dealing because the doctors may also affect the detail about the drug benefit and the side effects. Doctor may also receive the gift as such as a meal or the compliments or free compliments or samples of that particular drug. Means companies uh, try to promote their product, promote their molecule by visiting the doctors, the pharmacist, and other members to promote their drug, and visit doctors to prescribe their molecule to the patients. In a result that they gives their compliments such as dinners, conferences, after that the gifts, and such a samples of a drug they given in a free of cost firstly. After that the pharmaceutical marketing plans including the budget channels and their ideas which will take pharmaceutical organization and its product, and the pharmaceutical organization and its products and services uh, services forward in a current landscape. Marketing planning isn't easy work in the present extent on the marketing team. The external demands on the marketing team by the external demands and the other internal departments encourage the marketing team member to jump the right and short promoting the organization. In that there are total 6 stages of marketing strategies. First, sometimes may not always be benefit means every time we plan the strategy to promote the drug, to market the drug, is not get fulfilled or it is not get successful. Sometimes it also gets negative point of views. The pharmaceutical marketing plan includes the budget channel and the ideas which will product the service forward to the current landscape. Means the to promote their drug they need to budget, ideas, creative ideas, all that stuff is needed to promote that particular drug or that molecule. uh, SOSTAC. SOSTAC is a strategy of marketing planning. More to look the 6 stages of a marketing planning. SOSTAC is a short form, or it is a market planning strategy, and that is a S for SOSTAC. SOSTAC means S means situation analysis. After that O for objectives, CS for strategy, T for tactics. After that A for action, and C for control. These are the 6 stages of a marketing of a particular drug or the molecule. There is a range of marketing planning templates and frameworks are there available in the market. However, the leading plan is a static. SOSTAC model has emerged as one of the leading plan model due to its simplicity and the practicality. Because SOSTAC is a very easy planning and practical planning of marketing a drug or promote that particular drug or molecule. Then that we see the 6 stages one by one. That is a first one is a situation analysis. The first stage is a marketing planning process, is a review of current situations and the planning from the monitoring perspective and examination of a current and previous marketing plans activities. Means the situation analysis means in that stage we analysis and we study the situation. Means the previous molecules are about the previous molecules, the market situation, and what kind of action taken by us to promote our drug. All the statics are examined or analyzed in a first step of a market marketing of drug. After that, the objective setting. Second stage is objective setting. Once the current position is defined, it is then appropriate to determine the destined marketing position you wish to achieve. Your pharmaceutical organization setting such as objective gives to the perspective. After that, the target that your gives to the perspective, and the marketing activities. After that, the organization activities. Overall marketing organization objectives are get studies in the studied or get setting in that stage. In that, during this stage we are needed to the following we are needed to looking for the set of smart objectives. After that, align the marketing objectives with the organizational objectives and the select KPIs. After that, the third stage is determine strategy. The determine strategy is the strategic planning stage. Determine direction with the marketing and summarize how the objective set in a range uh, set in the stage 2 are fulfilled. A hugely important process of a marketing uh, plan that makes into account the previous section. Dietic and the organization is going to staff the position. This is an overview of a third stage of a marketing phase. After that, set upon the international marketing strategy, meeting with all of the stockholders and discuss the are the targeting particular market statements. How will we position ourselves in a market segment. After that, what is our communication of the content strategy. All that points are discussed in the third stage, means the determination stage of the marketing. After that, the fourth stage of marketing is a tactical implications. Tactical implication, that is a tactical stage of a planning process, will show exactly how impact the strategy determined in a previous section, which is generally more detailed than either of the other stages from a documentational perspective. This is a fourth stage of a marketing of a drug. After that, the fifth stage of marketing is a action planning. A marketing plan always going to feature the section which will determine and state the detail that the plan specifically what exactly are the marketing members doing with their working hours and when this will happen. These working hours in that action planning section which feature the detailed working out of the tactics. That is a fifth stage of a drug marketing. After that, the control. It is a last and a it is a last stage of a marketing, and by completion of this stage, the circle of whole marketing is completed. After that, the finally and go to the circle on the plan. It is a control stage, means it is a last point of that particular circle of marketing of a drug. The control stage identifies what we need to measure and how often and what needs to happen should we identify that the planning isn't working, or if it is not tracked meet the KPI set stage of 2 plans. Means in that control step, we uh, discover all the process and check that strategy is working or not. If the strategy is working, then that strategy is carry forwarded, and if that strategy is not working, then we should think what we are what is happening wrong with us, and what wrong happening with us means what kind in what stage we are failing, in what stage we are getting disappointment of a marketing of a drug. This is a basic or overview of a marketing of a drug. In that we see the basic information about marketing of drug. What is the marketing of drug? After that, the 6 stages of marketing of drug. That is SOSTAG. The full form of six means SOSTAG. That is the situation analysis, objectives, statics, strategy, tactics, action, and control. These are the total 6 stages of a marketing of a drug. That's it. Thank you so much.